The clinical question that we are trying to understand is whether or not massage therapy is an effective treatment for the management of hypertrophic scars in burns patients to reduce pain and increase scar pliability. The research article looks at scar massage for hypertrophic burns scarring and is a systematic review. It was conducted by Oltz et al. In 2018. The research aim was to review the literature and assess the efficacy of scar massage therapy in those with hypertrophic burns scarring. The study design was a systematic review. It pulled data from Medline, PubMed, CINAHL, and the Cochrane Library. The search parameters included burns injury, hypertrophic scarring, massage, and soft tissue mobilization. The method that was used was the Pedro scale, where outcomes such as range of motion, cosmesis, pain scores, pruritus, and psychological measures of depression and anxiety were extracted. The inclusion criteria looked at evidence which had undergone systematic review, meta-analysis, or were randomized controlled trials. Participants required partial or full thickness burns. Those from adult and pediatric populations were considered. The interventions included scar massage to hypertrophic scarring, including combination therapy, and outcome measures included range of motion, vascularity, pliability, quality of life, and psychological measures including pain. The exclusion criteria included narrative reviews, editorials, case studies, and abstracts. Those who had suffered from superficial burns with a general prognosis of less than 2 weeks to healing, keloid scars, and also comparison of scar massage to other modalities. The data analysis was completed by one reviewer for all included studies. Of the 211 initial papers, 194 were eliminated due to being duplicate copies or meeting the exclusion criteria. Thus, the systematic review was ultimately based upon 8 studies, which included 5 randomized controlled trials, 2 prospective trials, and 1 within patient design. The outcome measures for the systematic review included range of motion at wrist flexion, extension, radial, and ulnar deviations, characteristics of scar and scar tissue thickness, scar vascularity, pliability, and also scar height. When looking at the results, 2 studies measured range of motion before and after an intervention was performed and found no significant effects for any joints. Pain that was measured with the VAS scale was shown to immediately decrease post-intervention by a significant margin. Significant effects for massage was found on pruritus as measured by the Itchman scale. Significant effect was found in favour of massage for scar thickness, based on the Vancouver Scar Scale, and 2 studies found a significant effect favouring massage intervention for improving depression and anxiety and quality of life when measured with the SES-D and State Trait Anxiety Inventory. Let's now critically appraise the evidence that was presented and see how it will impact our current and future management for Runesh. The strengths of the article included a Pedro systematic review, which was used to appraise the evidence presented. The study characteristics were clearly defined. There was a very strict inclusion and exclusion criteria with quality assessment of study characteristics. There were credible outcome measures, which are considered the gold standard for burns patients, in particular subjective outcome measures. When considering the limitations of this article, there is controversy regarding the ideal objective outcome measures for those with hypertrophic scar tissue. The systematic review could not comment on long-term implications on massage therapy for periods longer than 3 months, and it was not clear if a trained health practitioner performed the massage therapy. Moving on now to validity, the study can be replicated using the information that has been provided. The study was conducted so that the results were relevant for the PICO intended to study, and the study itself only utilized high-quality evidence and data sources. Looking now at the negatives, the feasibility on objective outcome measures is still widely debated, and therefore results from the systematic review may not reflect the best standard of care for those with hypertrophic scarring. When considering the reliability of the paper, the study characteristics and methodology was stringent, the PICO group was relevant at all times, and there was no reported conflicts of interest which would create a bias. However, the systematic review excluded studies which compared massage therapy to other modalities. This resulted in massage therapy versus no treatment, which would assumably always provide positive effects. It would be ideal to see how massage therapy intervention contrasts to other already established interventions, and therefore provide a more accurate clinical representation of which interventions are more effective. Moving on now to clinical significance, the evidence from the review suggests a beneficial effect of scar massage on pain, pruritus, scar characteristics, depression and anxiety relating to hypertrophic scarring that had resulted from burns. There is a significant decrease in pain as measured with the visual analog scale. There is a significant increase in scar pliability, and there is a significant increase in quality of life measurements. Surprisingly, however, there is no difference for joint range of motion. Let's now understand how this appraised evidence can be linked back to the case study. The use of massage therapy will address the following patient problems that have been highlighted for Ranesh. This includes addressing hypertrophic scar tissue pliability to decrease associated pain and hardening of surrounding tissues, improving cosmetic viability of scar formation, improving overall patient quality of life, and reducing pruritus associated with burns injury. Therefore, massage therapy is a non-surgical intervention which has many different benefits that are relevant to Ranesh. In this instance, the intervention is indicated for use.